Welcome, Professor Modi. So, you coming here for the conference of Horizon. I would like to know from you, in your opinion, the relevance of Horizon conference for all the people who are attending today and people who are going to watch this video.
Well, the Horizon Conference has been a great experience. There's been a buzz in the air. Everyone has been so enthusiastic, and the overwhelming impression is that the problems that we all have are the same the world over. So if we have the same problems, clearly we need to look for the same solutions, even though they may be slightly modified depending upon every situation, every country's circumstances. But the fundamental problems are the ones we share together.
Right. And newborn healthcare is something relatively new in healthcare itself, if we really look at that. And there's a lot of changes been happening across the world. And how do you see the advancement of the newborn care happening around?
The very good news is that newborn care is at last on everybody's agenda. It's been a long time. You're quite right that for years and years and decades, newborn health was not the first thing people thought of. They thought of it last, but now they're starting to think of it first. And we've seen a number of reports from around the world, from the World Health Organization, from UNICEF, from countries, all pointing to the fact that we need to pay attention to newborn health. So hopefully this will be a wake-up call for governments around the world to take heed.
And in that context itself, because it's a relatively newer specialty, newer kind of modalities of treatments or new way of managing them will be important. In that, research will become a very important factor. You yourself have done research for over many years. You have helped people to do the research in the UK and around the world. So, if I may ask you, how do we promote research in India, especially with regard to newborn health?
Well, I guess it's a very complicated question that, but the simplest thing to say is, first of all, the fundamental principles of newborn care are well established and they should be delivered everywhere. But with each passing year, we realize how much we don't know and how much more we can do. And we have problems, we have questions at every level, at the community level, at the secondary level, hospital level, and then at the highest intensive care level. Now, there are so many questions that the only way we're going to be able to move newborn care forward is to research the answers. And when I say research, I don't just mean clinical research, I mean policy research. Does government know what's the correct thing to do, what's going to work best? Does the clinician know what's the best thing to do? Does the primary care, the community pediatrician know what's the best thing to do? So at every level we have questions that need to be asked and we need different forms of research. So the Horizon meeting has really tackled one area of this, but there is a need for multiple Horizon meetings to tackle each and every one of these aspects.
True. I mean, that's why it's a starting point, not the end. And we, as clinical leaders in this country, we are now looking more at how do we try to find the solutions for our problems. And in this, we started to believe that we need to work together. Now, together in the country as well as across the world as well, we will have to work towards the goal of improving the newborn health. Now, in that context, being the president of Royal College of Pediatrics and Child Health, what's your view on global child health?
Well, again, global child health, I think, is at last coming into its own. Everyone recognizes that a healthy child is a healthy adult. A healthy baby is a healthy child. It starts right at the beginning. So I think the clinical professions around the world have got a huge leadership role, because they can point to the fact that this is so important. They can start to find solutions together. And of course, as a professional organisation, what the Royal College of Paediatrics and Child Health wants to do is to help these collaborations, to facilitate them. And we can do that at clinician level. We can do that with our parents of the babies who we look after, young people themselves, and we've got a really fantastic program which includes the involvement of parents and young people. And we can also do it at policy level. So a professional organisation can also advise government. After all, we are clinicians, we understand clinical problems, and we can help to bring the attention of government to those problems, and we can help provide solutions. I think it's important for us not to go to government level and say, oh, we have problems, but go to them and say, we have problems, but here's a suggested solution.
I mean, that's the thinking currently that we as groups are discussing and trying to collaborate with the organizations and trying to advise the government, and that summarizes everything. And once again, thank you for coming down to India and giving fantastic lectures and participating in this
The
program.
pleasure's been all mine. It's been an absolute delight to be here. Thank you very much for inviting me.
Thank you very much.